Welcome to the Gastro Girl podcast. We bring together patients, experts, and health advocates who are all here to help you optimize your health. Here's your host, Jacqueline Gaulin.
Hey everyone, welcome to this episode of the Gastro Girl podcast. We are so excited today because we have the one and only Jessica Lebovitz, who is not only a registered dietitian with amazing GI expertise, and she's an expert in celiac disease, but she actually walks the talk because she's also living with celiac disease. You can't get any better than that, ladies and gentlemen. Jessica, so happy to have you on the show. It's long overdue, and welcome.
Thank you so much. I'm so happy to be here.
So we're just going to, get into it in a little bit, but I'm so curious. So when were you diagnosed with celiac disease?
So I was diagnosed in about 2013, 2014. I was already becoming a registered dietitian. So it actually wasn't the reason I became a registered dietitian, but it did lead me on the path to specializing in celiac disease.
Because I was going to ask you that. I'm like, what came first, the diagnosis or the expertise, career focus? But that's, sometimes it's like serendipitous the way we come into things. So before we get into the 5 things that we should know about celiac disease, in terms of what celiac disease is, just briefly, what is it?
Yeah, so I'm excited that you had me on for May, which is Celiac Disease Awareness Month. So celiac disease is a genetically mediated autoimmune disease in which gluten triggers inflammation of the small intestine. So this results in damage and malabsorption and, other consequences of all of that. So we do need to avoid gluten, which is a protein found in wheat, barley, and rye that provides structure and elasticity to food.
Okay. So one of the questions that might be on everyone's mind is, how common is celiac disease? Like, how many people are living with it? Maybe they're living with it and don't know about it.
Yeah, so about 1% of the general population has celiac disease, but 30 to 40% of the population do carry these genes, which would be the DQ2 or DQ8 genes. And only 3% of the population who has the genes go on to actually developing celiac disease.
Now, how would you know if you have celiac disease? Is it genetic? Do you have some symptoms? Like how do we tell? Is there a test? Like what do we need to know?
So you have to have 3 factors to ever develop celiac disease. 1 is having one of those genes. So there is a genetic component. 2 is that there needs to be some sort of stressor. So a stressor could be really anything. We're really unsure of exactly what that stressor might be. It might be a virus, an infection, a major trauma, but it could be something, very mild that is some sort of stress on the body. And the 3rd is that you need to be eating gluten. So pretty much everybody on our planet does eat gluten. So that one, everyone kind of checks that box.
Yeah. What I think is so interesting is that, and you have to take a test, right? Is there one test or, how do you know?
Yeah. So usually doctors will suggest that you do the celiac antibody test, and that will show if you have antibodies to gluten. If those are positive, generally, they'll recommend that they do an endoscopy and they'll do a biopsy of the small intestine to see if there is damage in the small intestine, and that would confirm celiac disease.
Now, what we learned we did a podcast with Dr. Nandi last year, and he did an overview more in depth about celiac disease. And he talked about, make sure if you go for the test, you are eating gluten, don't be gluten-free, right, Jessica?
So important. The tests are not accurate if you've already gone on a gluten-free diet. We are looking for your reaction to gluten in the antibody tests and in the small intestine. So if you have any thoughts that you might have this, you really want to get in to see a doctor before you've gone gluten-free. Or, some of our doctors will recommend a gluten challenge where you reintroduce the gluten so that we can have accurate testing.
Oh, wow. So now we're going to get into the good stuff. And you've geared your 5 things we need to know for those who have been newly diagnosed or have a loved one that's been newly diagnosed with celiac disease. Here are 5 things that you need to know straight from the wonderful Jessica, who is, like we said, is an expert registered dietitian in gastroenterology and GI conditions, especially celiac disease. So here we go, Jessica. What's the number 1 thing a newly diagnosed person or caregiver needs to know about celiac disease?
Okay, to start off with 1, For those with celiac disease, we need to know that gluten triggers inflammation in the body, causing damage to the small intestine. So the only way to allow the body to fully heal is to minimize the amount of gluten you're exposed to. So the recommendation is to follow the gluten-free diet to the best of your ability. That being said, everyone with celiac disease is slightly different, and everyone has different tolerances, sensitivities, and symptoms. So it's important to work with a specialized gastroenterologist and a dietitian to figure out exactly how strict you need to be on your gluten-free diet. Our goal is for your celiac disease antibodies to normalize and your intestines to heal, but it's also so important to maintain your quality of life while doing so.
This is so helpful because usually you think you have to avoid every little bit of gluten, and gluten can be in cosmetics, but I'm glad you pointed it out that there could be a little bit of variances, and why it's important to work with your gastroenterologist and especially your dietitian, who can give you some tips and guidance on how to prepare your meal so you're not missing any vital nutrients. So that's great.
Yes, and just on that, that is
Okay.
exactly what we do in terms of, working with your diet to see how strict you need to be, what nutrients you might be missing out on. And actually, we don't tell patients to worry about cosmetics. The amount of gluten in them is usually negligible, and the amount that you're ingesting, unless you are eating your lipstick, really should not be a problem.
Yeah, so don't eat your lipstick if you have celiac disease. And
Don't
your
do that for
lipstick has
many
gluten.
reasons.
No, we don't want to do that anyway.
Right, exactly,
No,
exactly.
but we joke and we jest, but it's, this is a serious disease, but we want to create a framework of understanding so it doesn't freak patients out where they're, oh my God, my life is over because I have celiac disease. It's not. Look at you. You're an amazing young woman. You have this beautiful career and you're happy and thriving. So don't worry if you've been just diagnosed. We got you. And we're going to go on with
Number two.
number two.
If you don't notice any symptoms from gluten, you still need to follow a gluten-free diet. Although you're not feeling those symptoms, it's still possible gluten is causing damage in your intestines, which can lead to other consequences. So, for example, gluten may be impairing your ability to absorb calcium and vitamin D, which can cause bone loss. So you don't necessarily feel those symptoms, or you might not be aware of that, but you can prevent that by following a gluten-free diet and preserving the integrity of your intestines. You may also be preventing any other conditions from developing later on in life.
Yeah. And we've heard, and again, not to scare people, but it could also, if you're a woman trying to get pregnant, it could have an impact on your fertility, or if you're having miscarriages, just because the body basically is attacking itself when it's trying to fight off the gluten reaction, for lack of a better way. Is that correct?
Yeah, so the inflammation caused by celiac disease, definitely has various manifestations, one of them being infertility. It is an autoimmune disorder, so there's a lot of connection between other autoimmune disorders, things like, thyroid diseases, type 1 diabetes, things like that. So following a gluten-free diet will really help you heal and minimize your risk of developing any of these other conditions.
Oh, this is great. Now, for any of those who may be listening, before we get to number 3, I want to point out a lot of people seem to avoid gluten because they think it makes them feel better. Now, there is something called non-celiac gluten sensitivity. What are your thoughts on that for those who may be listening that haven't been diagnosed with celiac disease, but they may be avoiding gluten?
Yeah, so there's so many reasons why gluten can trigger symptoms in different individuals. There can be non-celiac gluten sensitivity, there can be IBS. So wheat also has fructans in it, which can be a trigger for many people's symptoms. And what you really need to do is get evaluated by your gastroenterologist of what is the cause for your reaction to gluten. Is it celiac disease? Is it non-celiac gluten sensitivity? Or is it maybe more of an IBS type picture? And that way we know what is the most appropriate treatment for you. So someone with IBS, they might be able to find a way to incorporate small amounts of gluten, whereas somebody with celiac disease, that would not be appropriate. And with non-celiac gluten sensitivity, I see a real range. Sometimes people are able to tolerate a little bit more, and sometimes their reactions can be as severe as somebody with celiac disease.
Oh, well, that's really interesting. And it's really good advice. And it's always important to make sure that you're properly diagnosed or screened so that if you work with someone like Jessica, she knows what she's dealing with and she's not going down a path with you that may be the wrong one because you weren't properly diagnosed. And I know you guys do screening questions, you ladies and RDs, you're really, really thorough about making sure before a patient says, I'm celiac, you want to make sure that they really have had that diagnosis.
Right. We're not throwing gluten-free diets at people. We really want to know the medical diagnosis behind everything before we're treating and advising. And, as we said before, we really don't want people to just go on a gluten-free diet because that can really hurt your chances of getting an accurate diagnosis.
This is so valuable. Now on to number 3, Jessica, what do you got for us?
So number 3, although it may feel that all foods have gluten in them and you're left with nothing to eat, you'll eventually realize that there are endless gluten-free options. So if you aim for naturally gluten-free foods, such as fruits, vegetables, meat, fish, eggs, nuts, seeds, dairy, legumes, and gluten-free whole grains, you'll see that you're able to achieve a varied, healthy, gluten-free diet. And what I do with my patients is I really encourage them to aim for one new food or one new recipe each week.
Actually, that list, Jessica, is pretty long. It's not so restrictive as you think. It's more like what it's prepared with, it seems like, or maybe avoiding breads and things that pastas that have those gluten in it, correct?
Exactly. When I'm listing that all out, it sounds like there's so many options, and there really can be. Of course, when things are prepared with a sauce or a marinade or anything that's not going to be okay, of course, those are not going to be safe, but we can really look at it in a positive mindset and try to find the things that are going to be safe in your home. You have a lot more control, but there are resources to help you find things outside of the home that are still going to be safe for you.
Oh, that's great advice. And also we did a podcast with Erica, the celiac beast,
Mhm.
who showed us some snacky snack things that were
Yes.
gluten-free, and she couldn't believe that they were gluten-free. So we got that for you. And you do a great job on your website and your socials. You have all these great recipes. They look so good. And obviously you have celiac, so you're always preparing meals and preparing so you can share with your patients. Like, do you have any advice for where gluten could be hiding, like in soy sauce or things that we use generally? And I know we're going to get to your courses and your resources later, but just a couple things that you wouldn't say like, oh my God, I didn't know that had gluten in it.
Yeah. So I will say my lived experience as someone with celiac disease really helps me in counseling my patients, telling them, what restaurants to go to, what to ask about, what recipes to make. So that really does help. But I will say, things that are tricky, especially for somebody who's newly diagnosed with celiac disease that you wouldn't necessarily think about, things like soy sauce, matzah or communion wafers, imitation crab, malt vinegar,
Oh, wow.
seitan, licorice, beer, and couscous. So those might not be things you initially think about, but those are all sources of gluten.
This is such good advice. How about number 4? What's number 4?
Okay, moving on to 4. So although a gluten-free menu is a great step towards helping you enjoy a gluten-free meal, restaurant menus are not formally regulated. So unlike products, there's no formal regulation there. So the foods on the menu should ideally be gluten-free, but you still need to ask about how the foods are being prepared to ensure measures are being taken to minimize the gluten exposure and make sure the items are actually safe for you.
Now, do you have this is a really important one because we, even with whether you have IBS or EOE or some other condition that requires you to watch certain ingredients, like what are your tips for patients who dine out a lot or maybe travel, order takeout? Like, how do you protect yourself from knowing what's in there? Like, how do we do that?
So 5 perfectly aligns with number 4 is that there are actually resources out there that can really help you finding restaurants. One of my favorites is Find Me Gluten Free. It's a super valuable app and website that helps you find gluten-free establishments. And these
Oh,
resources really help you to get the most out of a gluten-free diet. This one allows you to search by location and see different places how celiac friendly they are. It also allows you to filter by specific types of food. So if you're craving gluten-free pizza or gluten-free bakery goods, you can filter for that and help you to find those options.
That's wonderful. Now, you've been so generous with your time and expertise, and you created two amazing courses for GI On Demand. One's at no cost. Tell us about that one. And then you created one, which is like working with you over a series. So tell us about that.
Yeah, I'm so excited that I was able to collaborate with GI On Demand. So the first one is a webinar I created called Celiac Disease 101, and that is a free course on GI On Demand. And then there's also a 3-part course that I created called Celiac Disease and the Gluten-Free Diet. And that one really offers a deeper dive into 3 parts. So the first part is shopping, planning, and cooking. The second part is optimizing nutrient intake. And the third part is dining out and traveling on a gluten-free diet. I actually go through how to navigate restaurants and travel and specific questions you want to ask for different cuisines, different types of foods, what is going to be important to ask about. So for example, if you're ordering fries, are they cooked in a separate fryer or they're being cooked in the same fryer as something else with mozzarella sticks coated in wheat flour? So those are the types of questions to ask. Some other tips within the tip is that I would say, you want to tell restaurants that you have celiac disease, or even sometimes calling it a gluten allergy if they understand that better, just so that they know. If they don't know, they don't even think to take those precautions. So if you think about, somebody who maybe comes to your house with a peanut allergy, but they never mentioned that they had a peanut allergy, you might not be thinking in the same mindset as you would if you actually knew that they did. So we want to be upfront about our diagnosis and about our needs. I always recommend patients call restaurants ahead of time or email them, really trying to call it off hours when you can get somebody on the phone and ask them questions. People are really responsive over email now too, but really kind of getting a clear picture, looking at the menu, seeing what questions are going to be appropriate. You usually don't have to ask so many different questions or one meal. You might just be asking 1 or 2 different things so you ensure that your meal is safe for you.
Tell us what a patient would experience. It's on demand. You can stop and go at your leisure. Tell us a little bit more how it works.
Yeah, so when you're using these courses, you get such a great overview of what I teach my patients about the gluten-free diet, about celiac disease, the manifestations of celiac disease, what to look for on labels, shopping, how to plan your menus. So it really is like working with me, but you're able to get a lot out of it at this reduced price point. And you're able to also get a lot of the handouts that I work on with patients as well.
This is great. What other resources do you recommend, and what do you use in your personal life?
So I would say the Find Me Gluten Free is probably the number one resource that I use. In terms of other things, I will say that Shar, the company Shar, has a great resource for very similar to the Find Me Gluten Free of restaurants and establishments that you can find that offer gluten-free options. Also, celiactravel.com has great language cards. So if you are traveling, you're able to print out different language cards in each language. So what I'll tell patients to do is print out a bunch of small ones, bring them with you, and then you can give them to the waiters to give to the chef so that when you're traveling around, you're able to express your needs and make sure that they understand in their native language.
That's so great. Oh, this is wonderful. So I know we're running out of time here. In closing, what's your advice for those who are newly diagnosed or their caregivers? Final advice.
My final advice is that the treatment for celiac disease is the gluten-free diet. So you absolutely want to be talking with a registered dietitian to make sure that 1, you're avoiding gluten and you're healing as best as possible. And 2, that you're getting all of the nutrients that you need. You're not falling short of anything, which can definitely happen on a gluten-free diet. And 3 is that your quality of life is the highest it can be, that you are, using these resources, you're managing, and you're living as normally as possible. I say I'm a total foodie and I just won't accept that a gluten-free diet is bland or underwhelming. And as you said, I share a lot of my recipes and travel, different information about gluten-free products on my social media at gfree_RD. So, you can definitely check all of that out there.
Oh, this is great. So thank you, Jessica, so much. And check out Jessica's courses as well as her other podcast episode where we're going to be talking about dating when you have celiac disease. So stay tuned for that as well. Thank you so much.
Thank you.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.